Hello, everyone. Today, we are going to be discussing a question from Typical PT's platform. Let's jump right in. All right, here's the question. Sex, male. Age, 58. Presenting problem, significant post-operative shoulder pain and limited range of motion after undergoing surgery for a full-thickness 2.5 centimeter rotator cuff tear. Surgical procedure, mini-open rotator cuff repair with subacromial decompression. Mechanism of injury, skiing accident. Past medical history, hypertension and hyperlipidemia. Medications, lisinopril 20 mg daily, atorvastatin 40 mg daily, acetaminophen 500 mg every 6 hours as needed for post-operative pain. Imaging, preoperative MRI revealed a full-thickness tear of the supraspinatus tendon measuring 2.5 centimeters with retraction. Subacromial bursitis, and mild AC joint osteoarthritis. Examination findings, well-healing surgical incision with mild swelling and tenderness. Limited PROM, remaining within surgical precautions. Special tests and MMT not performed due to recent surgery. As you progress the patient from PROM to AROM 8 weeks post-surgery, they begin to perform movements like the one shown in the image. Given the scenario and compensatory movement shown, which of the following actions would be most appropriate? A. Perform AAROM shoulder flexion in sitting. B. Improve AROM shoulder flexion. C. Improve AROM shoulder abduction. D. Perform grade 3 inferior joint mobilizations. Go ahead and pause the video right now. Think through the logic and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is A. Perform AAROM shoulder flexion in sitting. Answer choice A is correct because active shoulder flexion and abduction should not be progressed if the patient cannot perform the movement without compensations. In the image, the patient is hiking the shoulder during the movement, which means they do not yet have enough strength, coordination, or available range to perform full active motion safely. Because of this, the movement should be regressed to assisted active range of motion or passive range of motion until proper control is achieved. The patient presentation shows a compensatory shoulder hike during elevation, which indicates weakness or limited mobility after rotator cuff repair. In this phase of rehabilitation, the goal is controlled motion without substitution. Assisted active motion allows the patient to move through the range while protecting the surgical repair and preventing abnormal movement patterns. Now, let's go through why the other choices are incorrect. Answer choice B, improve AROM shoulder flexion, is incorrect because the patient is already showing compensation during active movement. Continuing active motion without control may reinforce poor mechanics and stress the repair. Answer choice C, improve AROM shoulder abduction, is also incorrect for the same reason. The patient should not progress to more active motion when they are unable to perform the movement without shoulder hiking. The focus should be on assisted or passive motion first. Answer choice D, perform grade 3 inferior joint mobilizations, is incorrect because aggressive joint mobilization and stretching are not typically recommended during the protection phase after rotator cuff repair. Higher grade mobilizations should be used cautiously and are usually delayed until the repair is more stable. Now that you've completed this case, take a moment to record the key points in your typical PT digital notebook. Use it to organize what you've learned and reinforce how to apply core integumentary concepts when evaluating and managing musculoskeletal-related conditions. Thanks for watching today's question of the day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.